the viewers.
A very good afternoon to you, sir. Thank you so much for joining us on the Nafeesa Dangor show on this rather stormy Thursday out here in Johannesburg. We must apologize for the delay. It seems as though I was driving through rivers this afternoon. Are you doing well today?
I'm doing very well, and I'm in Cape Town, and the sun's shining, and there's no wind. So I know I'm in the right place.
I think you are, most definitely. Let's talk about, firstly, I want to thank you so much for taking the effort and the time to join us. The show is all about, changing perspectives for people and encouraging them into better spaces. And I think this is where you come into place. Of course, I just wanted to talk a little bit about you yourself. I know you're Cape Town-based medical manufacturer producing brand new oxygen delivery devices to assist South Africans who are, of course, struggling in the health sector. But I think your company stands for many more things than just that. It's about being able to reach out to people and make differences in their lives as far as health is concerned. So talk to us quickly a little bit about your company.
Gabler Medical has been around for more than 50 years. So it's actually a family business and was founded by my father. We've been manufacturing other equipment that's had nothing specifically to do with COVID for many, many years. For example, we've been manufacturing suction and oxygen therapy equipment, which every hospital needs, and anybody who's ever had to visit a friend or relative in hospital would have seen this sort of equipment on the walls. We also have a factory that manufactures surgical sutures. But what's exciting is about a medical company based in South Africa is that we have the opportunity to react to the local market needs and to adjust our production to what is required. And as you can imagine, COVID has sort of necessitated a very different approach to business and in particular to the manufacturing of healthcare devices. And thanks to making contact and meeting up with a team of designers in the Eastern Cape in East London, headed by Dr. Craig Parker, we have been given the opportunity to team up with them and manufacture the Oxera device, which is an oxygen therapy device that is ideally suited for the treatment of COVID-19 patients. And it's very suitable to the sort of South African and also African conditions. That's what makes it such an exciting product.
I think looking at it, as I was researching it the other day, I found it a phenomenal project, something that is really going to actually make milestone changes within the environment that we're in. Because as we know, with the types of oxygen we're using, there's starting to be quite a huge amount of shortages due to the amount of oxygen that each patient uses. Coming to the Oxera, I think it's a phenomenal innovation because what happens is you're using much less of the oxygen than we were using initially. And I think that's absolutely phenomenal because what it does is it allows us to stretch out even further than what we could before.
Well, that's the strength of the device. I mean, obviously there are lots of devices that have been on the market for many years that are suitable for the treatment of COVID patients. Most of them require a mechanical support system, a ventilator, a CPAP machine, or a BiPAP machine, and they are very effective in the treatment of COVID patients. But the side effect or the byproduct of those devices is that they're, first of all, expensive to acquire, and secondly, they use a lot of oxygen. And the Oxera device, what makes it different from what everything else that's on the market at the moment is that the Oxera device has a lot of the benefits of high flow oxygen therapy treatment, including ventilation, but it doesn't use, as you pointed out, it doesn't use a lot of oxygen. So what it enables hospitals to do, and also clinics to do where there isn't an ICU, is to treat patients very effectively in an environment where there's not enough oxygen available. And also when ICUs are full, at the moment, healthcare practitioners have been needing to make very, very uncomfortable decisions about who gets into an ICU and who doesn't. And this device is going to bridge that gap for many people.
That is the sad reality that's been happening, is where doctors have been in the situation. And as you know, they take those oaths to save lives. But unfortunately, due to the circumstances that we've been in, it was having to do that pick and choose. And this is where Oxera comes into play. It's being able to actually help patients in many directions, and especially in the rural areas, as we know, they don't actually have access to any of these types of devices. And to get oxygen to them takes a very long time, because they, of course, in remote areas as such. So the Oxera device is something absolutely amazing, because what it does is it allows you to reach out to those particular patients that we couldn't have had to be prior to that.
You're 100% correct. Obviously, normal oxygen therapy, standard oxygen therapy, with a soft sort of silicone mask or a nasal cannula, that's the first sort of level of treatment, and that can be done in any clinic where there's sort of medical supervision, even in rural hospitals. But the problem comes when a patient is no longer responding to normal traditional oxygen therapy treatment. They then need to be moved to a tertiary hospital. And what the Oxera does is it enables patients to be treated in the rural hospitals, and many of them may not even need to end up in an ICU or tertiary hospital environment. So it's taking the pressure off the tertiary hospitals, where there's really a shortage of equipment and a shortage of beds. It's a very effective product.
I think it's an absolutely phenomenal product. Let's talk about the concept of putting it together, of course, with Dr. Craig Parker and them. Looking at this particular device, when I looked at the picture, it's so simplistic, yet so effective.
I know people look at it and think, well, how can this product be so effective? There's hardly anything in it. But what it does, and that's probably what makes it such a clever product, is it's actually made up of a lot of components that have already existed in different oxygen therapy treatment environments. And it's combined the features of various other products into a product that is extremely effective and has a lot of the benefits of an ICU-style treatment device. Even though it looks simple, it's taken us quite a few months to evolve. There have been months of launching products that in this direction that we then realized were not as effective. I'd say that even though the actual device that we've now put together only took a few weeks on paper to fine-tune, the development process of where we started and where we've ended up has taken quite a few months. And we're very proud of what we've achieved. And the fact that this product is so simple also means that there's no problem getting components, and there's no problem upscaling the volumes to the volumes that we might need in this country, particularly if we end up with another wave or even more future waves, which is very concerning because we don't know how quickly the vaccine rollout will be. But in the meantime, this product gives hope to people who need treatment.
Without a doubt, Mr. Gabler, there's two things you said. Firstly, you said you're proud. I think the reason Salam Media wanted to so get involved with having this chat with you is because we ourselves are so proud of what you've come up with, and how this has allowed you to save so many lives that we didn't actually think was possible when we just started off. And this device has created that added hope and faith to many people out there, especially, as I said, in the rural areas. The second thing that you said to me, I think, is absolutely phenomenal, that these devices, this innovation, so simplistic, has enabled such things. But I actually want you to explain to our viewers what the actual thing is made of, because I think that's the only way they really can appreciate the amount of time and effort taken. And as you said, it took months, because it's having to find, of course, the most effective version of it.
Look, it's difficult to explain without a picture, which I don't have handy.
I think we had one. I'm going to see if our engineers have one. Just give me a second, guys. Do we have a picture of Oxera? I think I had one, which I just gave to my producer. I'm just going to see if they can get a hold of that pic. If I can hold it up, that might even help. It's just, or what we could do is ask them, even our viewers, to go to the site as such. Do we have the picture? Let me just check with these guys. But in the meanwhile, let's just check further. So basically, as you were saying, you have been dealing in the field of creating oxygen therapy to certain, of course, to hospitals and things like that. And it's nice to see that you've teamed up with Dr. Craig Parker and this project. And many people, as I say, I always believe in teamwork, because what happens is what one person can see, the other doesn't. And having to come together with our strengths and putting it together is what has created this absolutely phenomenal innovation.
That's right. I mean, Dr. Craig Parker, for example, is a very unusual combination. He started off his working career as a mechanical engineer.
Yes,
and he developed a passion for medicine. And at the age of around 40, he moved across to medicine, and he's an anesthetist practicing at Free Hospital now. So there's an amazing combination of technical skills, medical skills, and of course we provide the vehicle to get this product manufactured and get it to the market. And of course, our companies, because we manufacture oxygen therapy equipment for hospitals, we ideally suited to manufacture the product. We also can supply all the sort of related products that are required to make the Oxera function. So it's an ideal fit. But while we're waiting for the picture to come up, I really want to say that it's also a fantastic opportunity for employment in South Africa, because if businesses take advantage of this, of local designs and actually create products that are locally manufactured, we are taking semi-skilled and unskilled people who are unemployed at the moment, and we're finding jobs for them. So this Oxera project has already increased our employment in the company by more than between 10 and 15 people, and as we expect the sort of demand to increase, we think it'll have a material effect on employment in our part of the world.
And I think that's great. I love the concept of your company, because the thing is, it's not just about that. It's about also reaching out to people and empowering them in many directions. And this is what it's done as well. I mean, as we know, we're in a very bad, hard lockdown. I call it a hard lockdown because I think many people have gone through loads of difficulties and challenges during this period, and they still are. So this is where you've come into play and actually created an environment for opportunity in two directions. Firstly, for reaching out into the health sector, and then so selflessly going to employ people and try and give them that empowerment they're looking for. But at the end of the day, it's also serving a very serious purpose. And I think that's what matters, is we are changing lives every single day just through Oxera itself. And I think it's such a phenomenal thing. And I really need to commend you once again. Yourself and your team have done an excellent job in actually going further during this COVID-19 period to actually find, should we say, a very purposeful and effective alternative to what is happening. A lot of the times people sit in a situation and they tell themselves, well, this is where we're at, what can we do? And they shrug their shoulders. Whereas Gabler Medical has gone the extra way with the team in East London and Dr. Craig Parker and said, listen, we are not going to sit back and wait for better days, because as we know, oxygen is the main thing people need when they get into a very dire situation as far as COVID-19 is concerned. So where do we come into play and how can we better it? And I think that is the phenomenal part about it.
Yeah, you're right. It's a rewarding story, and I think as South Africans, I hope that people listening will also take inspiration from this, because it does show that we can do it. We can design products that are really effective and that are world class, and then we can produce them in a record period of time, a very short period of time. Because there is in many industries in this country, we don't have the confidence to do things ourselves. We tend to focus on looking elsewhere to purchase and import. And I think this COVID crisis has highlighted, because we've had such massive supply problems for the healthcare products, that we do need to be able to look after ourselves, because the rest of the world will look after themselves first before they send product to us. And this is a good example where we've come up with a product that is locally manufactured, where the components are easy to source, those that we need to buy in, and the rest is manufactured in our plant, or with subcontractors like.
We'll call you the role model South African, because that's what it is. It's all about, we don't have to sit back and tell ourselves this is it and we don't know what to do. It's about getting innovative and asking ourselves what sort of solutions can we come up with to better our lives with the type of COVID-19 situation that we're in now. And it hasn't been easy. I mean, many people have lost loved ones, whereas this particular innovation is giving so many of us out there so much of hope. And when I looked at your device and the story behind it, I found it was something that we needed to actually inform everybody in South Africa about it. We're not, sure whether everyone is aware of the fact that Oxera is such an innovative, amazing, should we say, effective product as such. Would you edge on other medical companies to join you in this? Because I see you're doing something like 15,000 Oxeras a day. And there we have the picture up. That is the benefits and purpose of using Oxera. Doc, we have that picture up there so people can see what it looks like. Very easy, innovative device. It's not something that's evasive. It's easy to put on, like how you put on a mask and a normal oxygen piece. So it's actually a very easy thing, but at the same time, hectically effective. And I keep repeating that because I want people to know the differences, where to say that you don't have to only depend on the normal oxygen supply that is going on. There is an alternative and a very effective one.
Yeah, you're 100% right. I just want to point out so that the viewers don't get the wrong impression. It is a medical device. You need specialist medical training to actually set up the device and set it up on the patient. So whilst it is very flexible and can be used in environments, in rural areas, in small clinics, in medical centers, even in sort of medical centers at old age homes, I stress that it does need a medical practitioner to set it up, and the patients would need medical supervision. But once a patient gets to the point where they need to use the Oxera, they're too sick to be unattended at home. So it's not an easy fix in the home environment. It does need, the patient would need to get into a medical environment where there's medical supervision.
Yeah, I agree with you there. But what I think is what's so effective about it is the fact that if it allows you to reach out to more patients in the medical environment as such than what we could before. And I think that's important. That's the most important factor, is saying that, we do have a shortage of certain things. It is using less oxygen. So we're being able to reach out to a lot more patients, and we don't have to do that. And I know, listening to many medical doctors in the hospital environment, I think the biggest dilemma was, which patient do I save and which patient don't I save? And you've given now them the option to be able to try and save almost every patient that's in that hospital, depending, of course, on their comorbidities, as we say. But I think that's just the whole idea of it, and I think it's phenomenal. I want to ask you a question. Have you found your purpose? Because, I mean, you've done so many amazing things. And I think this is, like you say, the most purposeful thing in an environment that we're in right now. And, of course, the situation and circumstances that prevail.
It's a very interesting question. And in my lifetime, I'm sure the viewers can see I'm not a spring chicken. I've launched a lot of products.
That's the reason why I asked the question. I would ask it to the expert, of course.
So I must say that this is definitely the most exciting product that we've ever launched, because it has such immediate impact on people's lives and on saving lives. The products that we've manufactured over the years are all an essential part of the healthcare ecosystem. But this product is unique in the sense that it's filling a gap between standard oxygen therapy and ICU style medical treatment. And that gap is going to save a lot of lives, because any bed that has an oxygen supply, even if it comes from an oxygen cylinder, could be turned into a hospital bed for a patient, as long as there's medical supervision. So we're opening up the market of the treatment opportunity, shall I say, to all over the country, cities, countryside, remote places. As long as they've got oxygen, as long as there's a medical practitioner who understands how to set up this device, which any doctor that's been, even a general practitioner who hasn't practiced for a long time would be able to apply this device and set up this device on a patient. And that's what makes it exciting. It's not unique to the ICU environment.
But I think that's just the whole idea, because, as we know, ICUs have that much capacities that they can take. And that's the fear factor that everybody's having right now, is because our hospitals are full to capacity in the ICUs. And then people are having to, of course, go onto a ventilator, which is even worse. So I think this particular device is going to help us in many directions. And we want to, once again, of course, congratulate yourself and the team on an amazing and a job well done. We're very proud of you as South Africans. You've shown us the Ubuntu that you can get together with loads of other people that have similar potentials and reach out there in many directions. And as I said, it's about reaching out to those that are in dire need, and this is exactly where we are today.
That's right. I'm privileged to be part of this project.
Yes, and we're hoping you can make more than those 15,000. So tell me, there was a question that I would like to ask you. Is it just Gabler or does Gabler need any support from us as the public as such? What sort of help could we actually assist with? Because that's what it's about. It's about creating these support structures and be able to reach out more than we have before. So I think the idea of this interview was to bring this innovative, amazing project to the fore. Of course, you yourself, as you said, you're not a spring chicken, but to me, you're very young at heart and amazingly an innovative and inspiring individual. And this is why we needed to have you on. But from our point of view, is there anything that we can do from our side to be able to help out as far as Oxera is concerned?
That's an interesting question. I think awareness is a good thing. But at the end of the day, we need to rely on the hospital system, take the state purchasing system to mobilize and find a way of rapidly procuring a product like the Oxera product. We have had a lot of positive interest from NGOs. So NGOs that have got money, funds in reserve and wish to donate it to state hospitals. We've had a lot of approaches in that way. So obviously, if any of your viewers are involved with NGOs, there is an opportunity to help by channeling funds into the purchase of the Oxera device, which could then be given to the hospitals that need it most. But as individuals, there's not much that can be done. We need to mobilize the buying practices of the state. The private sector has jumped at it. They've been very quick to respond. But the restrictions on state purchasing and tender systems and so on is sort of limiting the response from the state side, and that's where we hope that pressure from individuals, and some of your viewers may be in a position of influence in state departments that are involved with purchasing medical devices. We need people to get excited about this product, to believe in it, that it can save lives, and mobilize the procurement processes. The device is not expensive, so it's not about price. The volumes are available in the volumes that this country needs. We can manufacture 15,000 a month. So it's not about that. It's about creating awareness and creating demand for the product. So it ends up in places where it can actually help to save lives.
Reiner, I have a question for you. There's been many doctors, medical doctors, that have been offering their services to COVID-19 patients, going to their homes, of course, checking on them and seeing if they do need oxygen therapy. So would you suggest, and as we were saying, it's only meant for a hospital environment, but would a medical doctor be able to use it in their rooms if they've been given the proper directions as such, or is it something that can only be used in a hospital environment?
That's a very interesting question. The device will work anywhere, even if you're sitting in a chair, as long as you have an oxygen supply, a normal oxygen supply of 10 to 15 liters a minute, which is what you can get oxygen concentrators that many people have in their homes if they've got breathing problems, emphysema or some other sort of lung condition. A device like that would be able to drive the Oxera. So it could be, in theory, be used in the home environment, but you would need the medical attention. You would need a doctor to take responsibility for the treatment, and then possibly to have a nurse in attendance to monitor the patient. So, there need to be skills. There need to be medical skills. But to answer your question, in theory, yes, you could be treated in the home environment.
Yeah, because there's many medical doctors, as I said, that are going out mobile and trying to assist these patients. But my question also was that maybe in their medical room they could possibly just set something up for the patient. There's a lot reaching out to COVID-19 patients to try and help them move into a better space, especially for those that are, don't have the accessibility and the affordability to go to hospitals. And as we know, the hospitals are so over flooded right now. So people are looking for that alternate help. But what message do you have for our viewers this afternoon?
Well, I think that the interviews already highlighted what an effective product we've got, and that it's actually enabled. It's creating a situation where we can treat patients who would previously not have been treated in the hospital environment, people that are more critically ill but couldn't find an ICU bed can now be treated with this device. But please, the viewers mustn't believe that this device can cure everybody. I mean, if somebody's lungs have deteriorated to a point where they need an invasive ventilation treatment, the Oxera is not going to help. What the Oxera is going to do is help, let's say, 80 to 90% of the people that may not actually need ICU ventilation, help them recover and thereby create space in the ICU environment for those people that have got conditions that cannot be cured by the Oxera device. So it is going to help a lot of people, and it's going to help take pressure off the healthcare system.
I want to thank you so much. I feel so privileged and honored to have spent this afternoon in the segment with you, sir. You've shed a lot of light on something that I thought had a very serious purpose, and I'm hoping that our viewers have understood that purpose behind it and behind what you've done. I really want to commend you. I can see the selflessness in you and your company. Having to always want to go that extra mile means a lot. So we commend you on it from myself and the team. Congratulations. As I said before, I think I was blown away and I was very excited to have this interview this afternoon. It meant a lot to me because this is what the Nafeesa Dangor show is about bringing education to the fore and uplifting people's lives through things like this, through role models like yourself. So thank you so much for taking the time out and joining us, and please do absorb some sunshine out there for me this afternoon in Cape Town, because it's been a rather stormy Thursday here in Johannesburg. Thank you so much. Do have a lovely day going forward, and we wish you nothing but the best. Do keep us in touch as far as Oxera is concerned, and of course the developments with Gabler Medical. We always look forward to hearing from you. Thank you so much. Take care of yourself, and a very good afternoon to you, sir.
Thank you, and goodbye.
Goodbye. That was, of course, Mr. Gabler from Reiner Medical. He's definitely given some insight and hope to us as far as the oxygen therapy is concerned. And, we know it's become a very serious situation with COVID-19, with the amount of patients that are getting ill. So that was very interesting and inspiring. We're going to go for a quick break. Stay with us. We'll be back with you in a moment.